I'm Savannah. I'm going to be doing my psychosocial assessment. First things first, I'm going to make sure that I follow GPSB and I make sure to follow my 11 rights, and I'm going to identify my patient using 2 patient identifiers. So can you tell me your name and date of birth? Okay. And what are you being seen for today? Okay, first things first, I will review their physical status, health history, and then assess baseline vital signs. And then I would ask if they have any safety concerns. Do you have any thoughts about harming yourself? Have you ever harmed yourself? Do you have thoughts about harming someone else? Have you ever hurt someone else? Do you have concerns for your safety? And then I would assess the appearance of my patient, so the grooming and dress, the hygiene, the eye contact, skin markings, posture, and body language. And then I'm going to go ahead and assess their affect and mood. So I'm going to assess if they're either flat, bland, animated, withdrawn, angry, or their mood, which would be anxious, fearful, irritable, sad, liable, or euphoric. I'm then going to assess their behavior / motor activity. So I'm going to be assessing if they're pacing back and forth, if they're combative, if they're slow, hyperactive, if they have good gait and balance, or if they have any abnormal movements, or if they are not keeping eye contact. I'm then going to assess their speech. So I would assess the rate, if it's slow, rapid, or normal, the volume, if it's soft or loud or pretty normal, the articulation, so if they're slurring, stuttering, mumbling, or disorganized. And then I'm going to, while they are having conversation with me, I'm going to kind of pay attention to their thought process and see if it's coherent or if it's disorganized and kind of flighty. And the content of their thoughts, or is it, are they delusional, or they have like obsessions or any suicidal thoughts? See if they like their perception, if they have hallucinations or illusions. I'm then going to assess their cognition. So if they're oriented to time, place, and person, I would just say, do you know where you're at? Do you know what time it is? Do you know what day it is? Do you know who I am? Assess their level of consciousness, if they're alert, confused, stuporous, or unconscious. And then I'm going to ask a couple questions about their memory to see if they have any short-term or long-term memory loss. And then I'm going to ask if they have any alcohol or substance abuse. What medications do you take? How much? How often? What herbal or over-the-counter drugs do you take? How much? How often? Do you drink alcohol? How often? Okay. Do you use recreational drugs? How often? And how much? And then I'm going to ask sexual patterns. Are you sexually active? Do you practice safe sex? Do you practice birth control? Okay. And then I'm going to ask about the patient's support. Describe your family. Okay. Describe your friends. Who do you depend on to give you support when you need it? Tell me about where you live. Okay. And then I'm going to ask about some interests and abilities. What do you do in your free time? Do you participate in hobbies or sports? What gives you pleasure? And then I'm going to ask about the coping abilities. What do you do when you're upset? What helps relieve stress? And then I'm going to assess their spiritual and cultural assessment. Do you have spiritual, religious, or cultural practices that we need to consider in the care we give you? Okay. Are there any restrictions or diet? Are there any restrictions on diet or medical interventions within your spiritual, religious beliefs and or cultural practices / beliefs? Okay. Okay, that's all the questions I have for you today. At the end of my assessment, I would make sure I report and record everything that was told to me. I would make sure to make a nursing note about doing the psychosocial assessment, and I would leave my patient in a safe position.